I'm Hope Rugo from the University of California, San Francisco's Comprehensive Cancer Center here at ASCO 2019, where I presented data on behalf of the SOPHIA investigators about a phase 3 trial testing a novel Fc-engineered HER2-targeted antibody in combination with chemotherapy compared to trastuzumab with chemotherapy in women with HER2-positive, heavily pretreated metastatic breast cancer. Margetuximab has had engineering of the Fc component of the antibody to have greater affinity for IgG Fc gamma receptors, specifically for the CD16A receptor. The primary endpoint of the trial was progression-free survival, which was statistically significantly longer in patients receiving margetuximab than trastuzumab, although the difference was relatively small. We looked both by blinded independent central analysis and by investigator assessment, and in both situations, progression-free survival was longer in this third or greater line setting where there are no standard therapies for HER2-positive metastatic disease. In an exploratory pre-planned subset analysis, we evaluated the impact of CD16A alleles in the efficacy of margetuximab, and what we found was fascinating. Patients with certain CD16A alleles appear to have an amplification of the margetuximab plus chemotherapy benefit compared to trastuzumab. Specifically, the CD16AF allele, the lower affinity allele, patients who have that represent about 80% of the population, 84 to 85%. In those patients, the progression-free survival appeared to be enhanced compared to patients who were homozygous for the V high affinity allele, where trastuzumab and margetuximab worked in a relatively similar manner. We have a first interim analysis of overall survival, and with that interim analysis in the entire population, there was no difference that was significant. Certainly at this point, the number of events is low. However, in the group of patients who had the CD16AF allele, there was a numerically longer overall survival in patients receiving margetuximab versus trastuzumab in combination with chemotherapy, which is very exciting preliminary data. We plan a secondary interim overall survival analysis later in 2019 and should have updated data, we hope, by the end of the year on this very interesting new antibody for HER2-positive, heavily pretreated disease, where there may be a specific benefit in patients who carry a different CD16A Fc gamma allele versus others.